All right, so today we're going to go through developing policy and managing risks. And any questions you have can be typed into the chat throughout the presentation. And my friend and manager, Graham Dearden, Manager of Learning and Resources, will be monitoring the chat throughout the presentation. And then any questions we don't get to throughout the presentation or at the end, you're welcome to send to us, but we will try to get to everything. So everyone should be muted. And with that, we'll get started. So you're welcome in joining me with our land affirmation, that is our practice at Volunteer Alberta. So Volunteer Alberta's main office is situated on Treaty 6 territory, specifically Amiskwaciy-Waskagan, as it is referred to by the Plains Cree peoples, among other Indigenous names, and the homeland of the Métis Nation. I'm currently presenting from Treaty 7 territory in Mohkinstsis, otherwise known as Calgary. Our staff, board, and our work reach across treaties 4, 6, 7, 8, and 10, and we affirm that the land we call Alberta is the traditional and ancestral territory, as well as present-day homes of many nations, including the Blackfoot Confederacy, Kainai, Piikani, and Siksika, the Cree, Dene, Saulteaux, and Nakota Sioux, Stoney Nakoda, the Tsuut'ina Nation, and the Métis people of Alberta, which includes the Métis settlements and the 6 regions of the Métis Nation of Alberta. So since time immemorial, First Nations, Inuit, and Métis peoples have cared for these lands, and they continue to do so today. And Volunteer Alberta identifies and affirms the historical and current relationships of these nations to the land as an act of reconciliation, and with the awareness that acknowledging, recognizing, or affirming these facts is a small step, and it is not enough. Volunteer Alberta is committed to reflecting on, critiquing, and changing our ways of knowing, being, and doing in order to start supporting and concretely contributing to reconciliation and Indigenous resurgence in ways we have not yet done. So within the context of developing policy today, we have the opportunity to consider the barriers that Indigenous people have faced historically and presently when it comes to exclusionary policies. So as nonprofits in Alberta and in the spirit of reconciliation, we have a responsibility to consider how your organization can contribute to an inclusive, accessible, and equitable volunteer program. So this webinar today is presented through the volunteer screening program at Volunteer Alberta. And VSP is a partnership between Volunteer Alberta and the government of Alberta. And we provide educational resources and tools designed to help nonprofit voluntary sector organizations improve their volunteer screening processes and procedures. And we also offer financial opportunities to aid organizations in their volunteer screening efforts, which includes the Vulnerable Sector Check Fee Waiver and Volunteer Screening Development Grants. And the next round of that is scheduled for next summer. So when we say volunteer screening or just screening, we're very broadly describing the process of defining the relationship between volunteers and organizations. And screening is a big topic that encompasses a lot of subtopics, such as what we're talking about today. But all of these topics collectively aim to improve the quality and safety of the programs and services in our communities. And lastly, please understand that Volunteer Alberta does not provide legal advice, and this webinar and our resources will provide some useful and general information, but any concerns specific to your organization and work you should bring to a legal professional. And with that, we can get started with our intro to policy. So nonprofit leaders and boards talk about policy a whole lot, and there's a whole lot of confusion around what the term means as well. But that's actually for good reason, because there's no consistent definition of policy. And although we reference policy all the time and take hours and hours to develop them, there is no single definition that will tell you exactly what needs to be in a policy and what doesn't. However, there is a lot of research around policy for nonprofits and specifically for volunteer programs, which is what we'll focus on today. And so some of the content in this webinar is based on, by definition, Policies for Volunteer Programs by Linda Graff. And when we want to define policy in some usable ways, there are a few key elements. So first, policies should apply to everyone with a stake in the organization: board, staff, volunteers, clients, or everyone in a specific group. So this doesn't mean that individual policies can't be particular to a certain group within your organization, but the whole policy document should have applications for everyone. Policy will also state a boundary of what is acceptable in the organization's specific context. So this requires that you go through the legwork to identify what, as an organization, has been decided to be acceptable. So you can consult all stakeholders in this process, including participants, insurance providers, board staff, clients, the larger community, in order to understand where those boundaries are. So next, a policy should provide guidelines for decision making. So when faced with a difficult, uncommon, or contentious situation, the number of possible decisions grows, and it depends, again, on the people who are involved. But a policy should be a wayfinding tool to help you navigate these situations more consistently and as a team. And lastly, policies are often viewed as separate from procedures. There's some nuance to this, however. But the best way to describe this difference is ideally, policies will tell you what to do and procedures will tell you how to do it. In practice, these become blurred as some professionals in the field don't think this is a useful way to talk about procedure. They see it as more helpful to talk about everything as policy, just with varying degrees of specificity. However, we are going to use this distinction between policy and procedure for the purposes of this presentation. So now that we have those general rules, they don't necessarily guarantee a good policy, however. A good policy is going to be equally difficult to define because it depends on the needs of whatever organization is producing them. So a good policy for a baseball team might not be a good policy for the government of Alberta. And neither is better or worse than the other, but they address different needs and different contexts. So when we talk about good policies, we still need to consider some basic qualities for good policy across any organization. So first, good policy should consider the perspective of the people most affected by the policy. So if your organization is developing a policy regarding training new volunteers, are the volunteers consulted in its creation? And you can also include volunteers in the review process. So there was a previous volunteer screening program survey called Changing the Conversation, and it revealed that 83% of volunteers who responded had never been asked to provide feedback on their organization's screening practices. So your organization absolutely might have good intentions and a good idea of what a volunteer might need, but for it to really meet the needs of the people it's meant to affect, it should be created in collaboration and in conversation with those people before you decide on the policy. And second, a good policy is well researched. In an ideal world, we're able to sit down and type it out and then approve it. But one of the points of policy is to plan for things you might not always consider. So again, we are more than happy to continue this conversation around policy with you if you'd like to reach out to talk through some of these considerations, and we'll go through more in the presentation as well. But when you develop policy, ask yourself if there is a good research foundation to support the policy. And make sure to check through associated legislation as well. For example, the Occupational Health and Safety and the Freedom to Care Acts, and find similar policies from other organizations. Ask other nonprofits on the topic, read about the subject, and so on. Third, a good policy should be relevant and necessary. So everyone should ask themselves why the policy exists, why it's important, and how it supports them to do the good work that they're doing to support their community. So in making policy relevant and necessary, it takes a proactive approach to addressing crises, incidents, and circumstances that can occur. So when and if there is an incident, the process to address and mitigate risk is laid out already, which helps organizations to continue supporting their community instead of getting caught in decision-making processes during unprecedented events. So there's no point in making a policy that will never be needed or addressing situations that will never come up. But that being said, this call needs to be made after you've researched and investigated into the needs and risks of your organization. So proactive policy, good policy, scans the horizon for potential risks. And although people aren't aware of what is really needed until it is indeed needed, you can still be diligent and careful with considering relevance and necessity. And lastly, a good policy is updated on a schedule. Whoops. That means on a schedule. So a policy's context is ever changing, and good policies must be ready to reflect this. So advocates, for example, must be in tune with what's happening on the ground concerning their policy, and they should be ready to know when to pivot, when to compromise, when to be comfortable with walking away from a policy, or multiple of those things. Policies need to be updated on a scheduled basis to ensure that they do reflect the organization and its community's current organizational, societal, and public context, which thereby reduces risks that are present. So now that we roughly know what goes into policy and why they're important, what makes it a good policy, we can address that context, which absolutely needs to be considered when creating policy. So it's important to remember how policies fit into other guiding documentation related to your organization. So writing a bylaw, policy, or procedure will also depend on what already exists, as it's never going to be written within a vacuum. Starting with legislation, your policy will have to align with any legislation for your organization. So we recommend that you read through whatever your incorporating legislation is, like the Freedom to Care Act, the Occupational Health and Safety Act, every once in a while, to keep yourself familiar with what the government requires every organization of your type to do. So most nonprofits in the province are incorporated under the Societies Act or Companies Act, and many nonprofits also have charitable status, and these should also be considered and reviewed. And beyond these common acts, there are all sorts of less common acts a nonprofit can be incorporated under, such as the Agricultural Societies Act, the Cemetery Companies Act, the Regional Health Authorities Act, the Libraries Act, or even special acts of the Alberta Legislature or Parliament. So all of these types of legislation should be reviewed regularly and should inform your policies. Bylaws can be a little tricky as they are legally required, like legislation is. It's essentially what your organization has stated that it will do to the government. So your organization also needs to submit bylaws to become a nonprofit, and these will be specific to you, to your organization, but they are the basic rules you have stated you'll follow. So they're also fluid, just like policy, and they need to be reviewed on a regular basis, just like policy, but there is a bit more precedent in determining content for bylaws than policy. So there are many topics to be considered standard for a set of bylaws, such as introductory articles and membership articles, but they still vary from organization to organization. So writing bylaws is a very complex topic in and of itself, and the Muttart Foundation's guidebook, Drafting and Revising Bylaws for Not-for-Profit Organizations in Alberta, is a great place to start if you're looking for more information, as it is very comprehensive. And then we get to policy. So as we talked about previously, these are the things your organization has decided it will do internally that specifies organization-specific gaps. These are the places that aren't addressed by legislation or bylaws. So policies are variable, and there isn't one set of policies that need to be made for any given organization. We all come from our own contexts, our own organizations that have different needs and different policies for good reason. And policies are the result of many people making decisions about which path the nonprofit will take, given many different social, political, legal, and financial constraints. So the policies are filling in some of those gaps and laying out what the organization will do. So again, we are distinctly defining procedures as apart from policy, the how we're going to do that. And then when we get to procedures, this is when you can start to outline discrete steps for processes introduced in policy. So for example, a policy states an organization will train volunteers. Procedure is how you're going to train volunteers. So in that case, a procedure can outline things like which person in the organization develops training, who administers the training, who updates the training, how and who tracks the volunteers who have completed the training, and so on. That's procedure. So highlighting policy again, we can start specifying the types of policies that we're making, as there are many kinds of policies that are all crucial for nonprofit and voluntary organizations, and also for running an effective volunteer program or any program. So first, a policy can be a statement of belief, position, or value, and this is going to be separate from your organization's formal mission and vision statement. But it can be statements about your organization's system of beliefs or how you do your work. So these are likely to be big, broad statements. For example, your organization might want to formally state that it is dedicated to social justice or supporting marginalized communities in a certain way, or it can even be a statement on the value of volunteers. Some organizations in the health sector, for example, might make policies that state they support harm reduction. So that would be an example of a statement of belief. These statements can also be narrower and pertain to specific programs. So if we're talking about an organization's volunteer screening, you could state in your policy that you are focused on your organization, or you could state, for example, in your policy that your organization understands that police information checks are only one part of a multi-step screening process, and that you will not rely on them as the primary volunteer screening procedure. And then you might want to lay out other steps to screening as well. Secondly, policy can be a method of risk management, which we'll get more into. And we recommend that good policy does address and does attempt to mitigate those risks. So policy can act as a mechanism to clarify what is and what is not acceptable to provide, again, those safe and quality services. So through policy, an organization can establish the boundaries beyond which its paid and unpaid staff can't go. So we'll get more into this as well further into the webinar. But for example, some sports organizations have a rule of 2 policy for their volunteers who work with children, and it specifies that there must be at least 2 volunteers with a child at all times, which creates accountability for their other staff and mitigates risk through limiting unsupervised access. So that's an example of risk management through policy. Rules. Thirdly, rules is the most common type of policy, and policies can specify as a rule expectations, regulations, and guidelines to help establish, again, those organizational boundaries and rules. So it could look like something as simple as stating that all volunteers are required to attend a 15-minute meet and greet with a volunteer coordinator. That would be a rule. And fourth, policies can be used to aid general program effectiveness. So when programs require certain deliverables or work to be done in a specific manner, this is what the policy can do. So it might be used to aid in reporting, for example. So suppose you need to track certain data for evaluation purposes, and in that case, you might make a policy that states volunteers must track their own hours or keep an activity log and submit to their supervisor at a certain time each month, for example. Another example of policies aiding program effectiveness could be, for example, a policy that stipulates what kind of agency a volunteer has in their role. So it can outline that a volunteer is expected to work within the parameters of their volunteer position description, but it can also give a clear indication of what to do during unexpected circumstances. For example, who they should contact if a crisis emerges, or what to do if another volunteer doesn't attend. Okay, so another way to divide up policies is based on the scope of the policy. So this is essentially looking at policy from the perspective of who the policy affects and who is responsible for developing it. So again, all levels of policy can be, and I would say should be, informed by and developed in consultation with the community, with the stakeholders, which includes volunteers, participants, staff, board, and members of a specific demographic. Again, everyone that the policy is meant to have some effect on. And all that to say, generally though, specific areas of policies will be a specific group's primary responsibility. So starting with organizational policies, this will primarily be a board's or senior management's responsibility, and this is looking at those belief statements, position statements, and values, as well as general rules to reduce liability. In general policies about a program, this could be the shared responsibility of the board, senior management, and program managers. Again, you're going to have statements of belief in there, general rules, but now you're starting to dip into risk management, the policies that mitigate and assess and manage some of the risks present. And then you're going to get into specific policies within a program. This would primarily be a program manager's responsibility. Again, there's going to be belief statements. There's going to be policies to manage risk. But this is where you're also starting on procedure and touching on how you're going to do what you said you're going to do. So to better illustrate what this could look like, we'll go through some examples, but it should be noted that none of these policies are meant to be copied and pasted into your context. They're just ideas for policy statements. But the policies you develop must ultimately be specific to you, specific to your organization and the context. So that also means there's no correct length of a policy document, just that there will likely be multiple policies within each category. So starting with organizational policies again, it could look like our organization believes in the fair and equitable treatment of all our clients and stakeholders. And or as an organization that provides programs and services for vulnerable populations, we commit to protect the confidentiality and privacy of all our members, program participants, employees, and volunteers. And then we'll move to general policies about a program. So it could look like screening volunteers is an essential component of effective risk management. That's a belief statement, and it is the responsibility of everyone in our organization. All ongoing volunteers will take part in yearly evaluation by the volunteer manager to help identify possible areas of growth and development for the volunteer and the organization. And lastly, we can get into specific policies about a program. So all volunteers working with vulnerable populations are required to undergo training conducted by the facilities manager before beginning their work. Again, starting to touch on procedure. And here, more about procedure, volunteers are required to submit a log of their work at the end of every volunteer shift, or for volunteers who work irregular hours, at the end of every month. So again, we're touching on risk management for sure, making sure everyone's trained in that first one, but we're also stating how we're going to do those things that we've stated we will do. Okay. So now that we have a bit more of a clear idea of what policy is and how it can manifest in our organizations, we can take a closer look at how policy can mitigate risk, which we've talked about. So we often talk about policy and liability as topics inherently related to each other. And while not every policy is made to manage risk, we talk about them as related because a policy can act as a way to establish plans to address potential hazards and also prevent them. So volunteers, program participants, employees, and other stakeholders can be involved in a very wide range of risky situations when working with a nonprofit organization, especially when we're looking at direct service nonprofits. So sports organizations have risks embedded into their work because of the potential of people being hurt while playing a sport. And health organizations, as another example, are responsible for the well-being of their clients, which can create a lot of space for risks to people's physical and mental health as well. But many nonprofits, all of us here, have risks that are more difficult to spot on the surface. For example, who is handling your organization's money and how do you know that they can be trusted with it? Another example is your organization's office building up to code if you have one? Who's responsible for the safety of people at fundraising events or any type of event? Is your organization compliant with labor laws? And note that in the Occupational Health and Safety Act, volunteers are covered under that act as workers. They are considered workers. Every organization will also face cybersecurity threats. So what awareness and training do your organization's personnel have to mitigate cybersecurity risks? And then considering the board of directors, they must also consider what they could be personally held liable for. Claims like wrongful termination, for example, discrimination, harassment, and misallocation of funds. So what measures has the board taken to prevent these cases through things like policy? So that's why legislation mandates certain rules within nonprofits to ensure they are accountable to the community that they're supporting, and the larger community. And this is why organizations are required to bring in auditors and why the board of directors must have liability insurance. And so policy, however, is where you can start to plan out accountability mechanisms for circumstances particular to your organization and particular to the current programming. And this is also a form of due diligence in fulfilling your duty of care for the people involved with your organization. So to provide a very, very brief overview, duty of care is an organization's obligation to take reasonable measures to care for and protect staff, clients, participants, volunteers, and the organization to an appropriate standard. It's a legal concept, and that should guide every decision. It should guide decision making at every single level of your organization. Duty of care, and the appropriate standard of care depends on the situation, and it depends on the risks that are present. And so, to demonstrate due diligence, safely manage programs and services, and fulfill duty of care, every organization should take every measure possible and accessible to them to continue the appropriate care for the community. And one of the ways to do that is to have policies in place to mitigate risk and assess potential situations where harm could be done. So to move on to risk management takes a proactive approach to an organization's operations as it seeks to avoid or reduce risks and losses in the first place. So prioritizing research into a policy and writing, thinking about consulting to create an effective policy means that the time spent now will save time later and also potentially reduce harm later when incidents might occur, instead of scrambling to address the risks if and when something does happen, while also trying to do some quote unquote damage control might mean there's some unnecessary stress that could be prevented by developing a good policy. So insurance is one of the many tools your organization can use to manage risks and liabilities, and is not the only thing that your organization should consider when looking at risk management. But that being said, it's a part of the process, and it's one that we do get questions about. So we'll touch briefly on insurance to provide some high-level good practice. First thing to remember, so if you're shopping around for a commercial insurance plan, look for representatives who have a good understanding of your organization. So if you're talking to potential providers, come prepared with questions about their experience with nonprofits, and also be prepared to provide a list of business-related property. So the quoting process may involve some back and forth. And again, the cooperators team is a resource that you are welcome to contact regarding insurance and liability questions. And their contact information will be on the last slide of this presentation. Next thing to remember, so with insurance policies, it's important to keep your insurers updated with changes to your operations. So how you conduct programming with the public, or even how you structure your organization, or just the types of work you can do, can impact your coverage. So whenever you make any substantial changes to operations, be ready to ask your insurance representative if your coverage is still applicable. And it's important to be comfortable talking to your insurer. And this rule also applies to volunteer screening. So if you change how you screen volunteers, that can also have insurance implications that you should bring up with your provider. Okay, so a key part of the risk management process is knowing how to assess the various components of a situation correctly. So we're going to go through a volunteer position as an example, but I will also note that a risk assessment for a volunteer position should be conducted on the role itself, regardless of who fills the role. Yes, you can do a risk assessment on each individual, but the role itself is going to have inherent risks embedded into it, and a risk assessment on a position looks at those risks regardless of who fills the role. So what you're looking at here is Volunteer Alberta's risk assessment template, and then we'll also go through the risk assessment matrix, which are free tools developed to assist you in your risk assessment process. So we're going to go through and create an example of a volunteer position to illustrate how you can use the matrix. So we're going to look at this example of an administrative volunteer. So the first step in the process is to look at the template and fill this out, what you do know about the role. So starting with purpose of position, the admin volunteer exists to support administrative staff by checking in students for classes and the overall operations of the front office. They will be shredding files, answering the phone, managing client files as needed, and welcoming guests and participants. So again, this is theoretical, but I know that many organizations have admin volunteers. But again, it's up to you, up to your context to look at the specific policies that could be written. So back to the template, the clients are children accessing, in this case, the organization's art classes. And the location of this role will be in the office, but the office and classroom are in one office building. It has windowed walls facing the public hall, so high visibility, and each classroom has windowed doors facing the office. This is going to be a 3 to 8 hour a week commitment, and they'll be working with, but not directly supervised by, admin staff, and a general orientation provided by the volunteer manager, and role training is going to be administered by the admin staff. Other details that are important to note is that they will be interacting with participants as they enter the main office. They'll be given password access to the CRM database to update attendance, and they also will know the code for client files to update information when asked. That's the role that we have right now. So again, one of the tools that we have, it's a very popular tool, is the risk assessment matrix, and it can also be found on our resources page, and it will be sent out to all of the registered attendees for today. And this matrix is meant to be used on volunteer positions. Again, not the volunteer who fills the role, the position itself, because it measures the level of risk inherent within the role, inherent to the tasks, regardless of who the volunteer is. So this matrix doesn't give you a clear indication of specific actions you should take when a position is considered high or low risk, because your organization should determine those. And we'll go through examples. But this matrix just gives you an idea of where various degrees of risk come from within volunteer positions. So it is tailored to be specific to risk as it relates to clients. But you're free to develop this matrix to assess risk to volunteers or to the organization, depending on your needs and context. So to start, the admin volunteer will frequently interact with clients as they come into the studio through the front office. So we would place that as a medium risk. The volunteer will be working in the main office that is open to the public. Again, it has that wall of windows facing the hallway of this office building. So this would be a low risk setting. They will also supervise, the admin staff will supervise the volunteer most of the time, so that would be a lower risk. And since the volunteer can access student files to update their attendance records and perhaps see other sensitive information, this is a higher level of trust or authority. So this would bump up to a medium risk. And the volunteer has no reason to be in physical contact with clients. So we can look at this matrix and see that there are risks involved in this role. So when we move to policy, we can consider that. So we've gone through the volunteer role, we've looked at the risk inherent to it, and now we can start writing policy to lessen some of those risks, potential risks. So I must also note that, again, these policies are not meant to be copied and pasted from this presentation and used by any organization, just to give you a guiding point. The first potential policy. The volunteer must be supervised at all times by other volunteers or paid staff members and cannot place themselves in private one-on-one settings with clients. A very clear boundary is demonstrated there. So even though we've established the main office is exposed and there's a public setting aspect, and that the volunteer will sometimes be supervised, to avoid situations where volunteers are helping people in the washroom or non-visible areas, as an example, it could be good to have a policy stating that they should only be doing these tasks in public. or with another volunteer or staff member. There should constantly be supervision, in this case, by volunteers or other staff. Secondly, the admin volunteer is required to complete Freedom of Information and Privacy certification and sign a confidentiality agreement before starting the volunteer position. Again, this can be added into the volunteer position description that you make, as well as policy. Third, the admin volunteers are required to participate in an on-site orientation conducted by the staff, focusing properly handling office supplies, equipment, and online systems. Could even expand on what supplies and equipment specifically to outline better what the volunteer is expected to know, and even perhaps equipment that or software or something that is off limits to them as well. You can be as specific with that as you want. All on-site staff and volunteers are required to complete first aid training before the start of their first shift. The organization will cover costs. So in this made-up scenario, the organization's liability coverage requires that all on-site personnel be certified in first aid. So although this might be a big ask for organizations, this type of risk mitigation could be best in the long run. Again, reducing harm, reducing liability. And remember, a good policy is a proactive one that addresses potential risks to help you maneuver through those different events if and when they arise, so that your organization can continue supporting and doing the good work you do to support your community and the participants. When it comes to volunteers engagement and removing barriers, covering costs would be an important step as well that you might even want to just commit to through policy. Okay, so those are potential policies in that made-up scenario. However, there's many possible policy areas to help mitigate risk. But it's not always clear what they are. So we're going to go over some general areas of policy that you can decide to research into if you feel inclined to do so. But please note also that policies, again, need to be developed on an organization by organization basis. And this list that we'll go through is by no means exhaustive, or it might not even be suitable to use for everyone. It's just a place that we've noted is a good place to get started. Although we are open, more than happy to continue chatting with you beyond this presentation, we do also need to remind you that VA does not provide legal advice. So any questions specific to your organization should be discussed and referred to a legal professional as needed. So a good place to start is the right to volunteer. So this policy area outlines what right volunteers have to volunteer with your organization. So generally, volunteers have a right to volunteer their time, absolutely. But you may want to consider how to work through these requests and what volunteer positions they have a right to fill. For example, it would be a massive risk if your organization allowed just anyone to serve as treasurer. So finding a person for this role requires screening that balances the level of risk of handling the money within the role to determine the best fit. So there might be a different process to screen someone into the role of treasurer. And secondly, there are going to be different kinds of volunteers from all sorts of backgrounds and skill sets, which all present different needs and different risks. So it's important to consider what position your volunteers might be in before they volunteer. So for example, what if your clients want to start volunteering with you? And so if you work in an organization where clients have specific needs, would those needs be met using your standard volunteer policy? Or would there need to be additional statements about how to support different kinds of volunteers from different backgrounds? Again, a good practice is to write it in consultation with these different communities. And what if an employee decides to volunteer for your organization outside of their work? Do you know if their employment contract and provincial labor law allow for the kind of volunteering they'd like to do with your organization? Is it clear exactly where their compensated work and uncompensated work ends? And many organizations also work with volunteers who come to the organization via a third party, such as unpaid practicum students, court-mandated volunteers, or loaned executives. And for them, your organization may need to develop policies that address the needs of that third party and for that type of volunteer. Volunteers can also be one of the most powerful elements of your organization's decision-making about future volunteer programming, especially when it comes to mitigating risk. So that's why it's important to consider representation in decision-making. And so it can be very helpful for your organization to outline how it handles suggestions from volunteers around the decisions it makes about programming and for policies. So for example, if a volunteer is working with you in a high-risk role and they identify risks you were never even aware of, what kind of agency does the volunteer have to take action about that risk? So do you have a system to take their suggestions, for example, or do volunteers know who they can direct their feedback to? Do you involve them in the strategic planning or operational planning? So volunteers are people and they should always have a right to feel safe and welcome in their volunteer roles. And think about your clients and community. Would it be a risk for your organization to not formally state how it promotes an inclusive and welcoming environment for its volunteers? Is there any possibility for your volunteers to disengage because they don't feel welcome? And maybe this policy also needs to be developed in conversation with your community. So health and safety, there should be a policy that facilitates the health and safety of volunteers, but even in an office-based setting, having an adequate health and safety policy still makes sense. And it could be as simple as laying out policy around working in the office alone or who needs to have first aid training. Also make sure to take into account the health needs of your community. Again, in consultation with the community. So policy around harassment can be very, very important for everyone to consider, especially with vulnerable populations. And this could be outlined in a general policy that applies to all organization representatives. Just make sure to have it adequately communicated to all representatives, including volunteers. So it's important to note that harassment is often hard to solicit feedback about, which is okay. This just means you might need to speak to your HR team or person or speak to an HR rep from another firm, just so that they can let you know what would be important for a harassment policy. Again, to create a safe program for the community and to prevent harm and risk. So conflict of interest policy most often comes up around board members, and this happens primarily when volunteer board members use their position to unfairly influence organizational process to serve their own interests. It can, however, stretch beyond board members to direct service volunteers and employees as well. So for example, if a volunteer is helping with planning a program and works as a contractor outside of their volunteer work, it might be considered a conflict of interest to hire them for program duties without asking other contractors. And that is related to the legal concept of duty of loyalty, especially for, again, the board and directors. Policies about policies. So it can be a significant step towards mitigating risk to ensure that your policies are actually understood. So this could look like a policy for your volunteer program. Could start with ensuring that policy is clearly communicated to volunteers, whether that be on the onboarding process or through a handbook or some other orientation, for example. And lastly, the right of refusal. So your policy might need to also talk about what your organization would do if a volunteer refuses to do a certain task. So according, again, to the Occupational Health and Safety Act, where volunteers are considered workers under that act, they have the right to refuse dangerous work. So your policy can also reflect how your organization wants to work through refusals. Some questions you can ask is, would refusing to do a task cause harm to another person? Would it cause undue hardship for the organization? And if the task is needed, who steps in to cover it if a volunteer refuses to do it? So again, these are possible policy areas to help mitigate risk, but the list that your organization needs to look at might be double this amount or might be part of this. Again, it's about knowing your context and understanding the the specific needs of your community in consultation with the community that you're supporting. So you're more than welcome to check out the volunteer screening program page to look at the services that we offer. And I'm very excited to announce that we have an upcoming webinar on November 22nd on developing volunteer positions. So we'll get more into what that process looks like. It is November 22nd at 11 a.m. So like today, Wednesday morning at 11, and I'll be sending out the registration link for that for all registered attendees. And we'll also be sharing more on our social media platforms, LinkedIn and Facebook. And if you are a part of any of the newsletter emailing lists, it will also be on those. So the volunteer screening program offers free coaching to nonprofits in Alberta who are interested in learning more about volunteer screening. Or if you'd like to continue the conversation we've had today, you're also welcome to get in contact with us. You can email us at screening@volunteeralberta.ab.ca. And you can also access our resources from our resource library too through our website. I will be sending out links to the template and matrix that we've gone through today, but there are also more free resources from their volunteer screening program that you're welcome to look through as well. So all registered participants will be receiving this presentation recording and all mentioned resources. There will also be a follow-up survey that we would really appreciate if you take the time to share your feedback so we can continue to create meaningful and helpful webinars and presentations to support nonprofits in the province. Insurance, risk, and policy are all very related, so picking a good insurance plan is important. The Cooperators offers nonprofit insurance through Community Guard if you're interested, and you can reach out to them at strategic-client-management@cooperators.ca and visit their website. That is the end of our presentation. We will move to our question and answer time. Thank you so much.